Hi guys, this is Alicia with Good Morning Sunshine. Today again is week 5, day 24, I believe. We had a lot of lectures today. Like I said, we were there 8 to 5. We actually got out of 4, which was nice. We had 4 lectures this morning, then we had lunch, and then we had 2 labs after lunch. So it was a long day today. First we learned about radiographs. Second, we learned about renal, and then we learned about urogenital. So, and then our labs consisted of the equine and bovine anatomy, and then we had microanatomy for histology. So first I'm going to go into radiographs. We were doing small animal abdominal radiographs and learning about those. So after this lecture, we were supposed to be able to identify the liver, the spleen, the kidneys, the bladder, the stomach, the duodenum, the small intestine, the colon, and the cecum on radiographs. So I'm going to start here. So again, we have 5 basic subject densities. So we have metal, bone, soft tissue, fat, and air. And then we have, and those correlate with opacities, metal being the most white, and then bone, and then it gets grayer down the line, and then soft tissue is more gray, then fat is a darker gray, and then finally air is black. So in the abdominal, the fat around allows us to see structures, because a lot of the structures in the abdomen are soft tissue, so some are very hard to differentiate between. Also, there's gas within the lumen that is spread sporadically throughout, so that also helps too. So here we have the normal canine abdomen. So dogs usually have fat in their falciform and their rear ends, whereas cats have fat in their falciform and their inguinal fat pads, and their small intestines in a cat are usually more fluid filled. So here's normal cat x-rays on the top there. And then the next x-rays we have showing everything of what we're supposed to know. So first we have so these are abdomen x-rays. We have a VD version, and then we have the lateral versions. But first would come liver, and then the stomach, and then of course the spleen, because the spleen is attached to the stomach right here. And also right there, you can see it up right there too. And then we have the small intestine, and then we have the colon in the back. But also here, you would start on top, which would be the liver, the stomach, the spleen, the kidneys, and the colon. So that's a normal view of a canine. And then we got into ventral dorsal views, which I showed you above as well. So we started with the liver, of where that is. It is the most cranial abdominal organ. It's in contact with the diaphragm. It's usually right behind it. It's cranial ventral on both views, so the lateral view as well as the VD view. So here is the lateral versions and where the liver should be on a radiograph. So it should be right here. And then in the VD versions of the liver, it should be up top right here. And this is what the liver looks like on ultrasound. And then next we got into the spleen. The head of the spleen is fixed in position, and it is in close proximity to the fundus of the stomach. So the stomach has different parts, fundus being one of them. It is oval in shape, and the tail of the spleen is usually seen as well. The spleen you can see in different parts. Like you'll see the top of it somewhere, and then you see the bottom of it somewhere, but then it's covered by different abdominal organs, so you wouldn't see the middle of it, but you should know it's the spleen. So here's the lateral version. So like I said, you can see the top and the bottom of it here, but not the middle. But here on this one, you see more of the bottom, but you don't see the top of it. So you just kind of have to know it's the spleen, because the spleen is also attached to the stomach. And here is the ventral dorsal version of the spleen. Usually the head of the spleen is on the left cranial aspect next to the fundus, like I said. So it's over here. And here are the spleen ultrasound appearances. And then we got into the urinary system. The left kidney is furthest caudal, so to remember left kidney, you remember it by being left behind. So usually the right kidney is more cranial. And the right kidney is usually next to the caudate lobe of the liver. So I know they're a bit hard to see, but I'm going to show you kidneys. Again, the left one being a little lower than the right one. Oh, here's a better picture. These show you like where exactly they are. So kidneys, bladder. And then you can kind of see the ureters. Usually you cannot see them, but they used contrast here. So you can see them. And then let's see. Again, here's more pictures of the kidneys on a lateral view. So kidneys, bladder, ureters. And then this is kidneys on ultrasound here. Those are canine ultrasound, and then we have feline here, ultrasound pictures. In this one right here, there's a cyst in the kidney. So you can tell because it's black. So it means it's fluid filled. And here's also the bladder, but the bladder is usually fluid filled. This is how they get pee usually. So then we got into the urethra. The urethra is normally not seen on survey radiographs because they're soft tissue and opacity. They're usually hidden behind the bony pelvis. The femur also gets in the way for the male dog, so you'd have to move these in order to see the path of the urethra. And the stones usually get lodged here or in the os penis because they can travel through the urethra, but they aren't in compliant of traveling out through the penis. So here's how you take these shots. They're a little abnormal, but this is how you would see the ureter's path. Or the urethra, sorry. But they use contrast in order so they can show us. So again, like I said, the stomach has different parts to it, and I was going to get into that. So there is the fundus, there's the body of the stomach, there's the antrum, and the pylorus. So here's the stomach, here's the fundus right here. So here's the esophagus, and then next to the esophagus is the fundus, and then you get into the body in the middle, and then you have the antrum, and then the pylorus right here, which usually heads out. This is the duodenum right here. So we need to know that the fundus is dorsal and to the left, and that gas is going to rise if animal on the sternum and shooting dorsal ventral. Gas will rise to the fundus. Then the pylorus is fluid filled. However, in the VD version, fluid is going to fill the fundus and gas is going to rise in the pylorus if the dog is lying on its back. So there's major differences when you're taking x-rays between DV and so dorsal ventral and ventral dorsal, because the dog's either laying on its back or it's laying on its sternum. So here's the differences in these. So dorsal ventral here, you have VD here, you have dorsal ventral here, and VD here. So the darkest part is the gas of the stomach. The fundus is dorsal. The gas rises into the fundic region when the animal is in ventral recumbency. So that's VD recumbency, which would be these ones. but the gas moves into the more ventral portions of the stomach if the dog is laying in dorsal recumbency. So that's dorsal ventral. The position and shape of the stomach depends on the species. So cat versus dog, the female stomach predominantly within the left cranial quadrant, and the pylorus is usually on the midline. However, the canine stomach extends from the left body wall to the right body wall. So here's the differences of what the stomach between the feline and canine would look like. So here we have the canine here, but here is the feline. So as you see, this one's more towards the midline, whereas the dog goes from left to right. Then we got into left and right lateral shots. The gas rises to the right side in a left lateral shot, and the pylorus becomes air-filled, whereas the right lateral fluid would be filling the pylorus. So we have to note that recumbency influence if there's gas or air in the pylorus. So fluid is gravity dependent and air rises to the top. So here's the stomach ultrasound picture. So then we got into the small intestine. We're gonna look at it with the GI tract with barium. Barium being the contrast material that we use for x-rays. So here's this. So this is the fundus right here, leads into the pylorus and then into the small intestines here. So like the duodenum and all of that. So again, here's the duodenum, what I was talking about. It's the yellow here, yellow here, yellow here. That's all the duodenum. And then we got into the normal feline upper GI series. In a cat, it looks like a string of pearls. And then we got into the colon. The colon is easiest to see from the pelvic colon, and then you follow it. So you start at the end, and then you just follow it up. The majority of the time is usually on the left side. The transverse colon is usually across the midline, caudal to the stomach. The cecum is usually a comma-shaped, and it's right at the ascending colon by the ileocollic junction. So here is the colon, so you would follow it from here and go up. Here's the comma shape that I was talking about, for that being the cecum. And then you have the transverse, which is usually crossing the midline. So the transverse would be like right here. So then we got into CTs and transverse planes of the abdomen. Here's an abdomen CT. And again, the black fundus is dorsal left and the pylorus is ventral to the right. So here is the fundus right there, and the pylorus is over here. So this is just cross-sectional imaging. We don't really need to know all of these. He was just putting it in here so we had identification of them. So a lot of CT scans there. And that ended our lecture of radiograph of small animal abdomen. And then we had Dr. Bonnie. Love her. For 2 hours again. And she was doing the overview of renal function. So this will be fun. Urogenital is next, so that's even worse. So we started with the importance. The kidneys play a dominant role in regulation of the whole body homeostasis. So again, kidneys are far more than just that they make pee. The kidneys end up involved in various functions that directly or indirectly involve nearly every other body system. Its major renal function is ultrafiltration, or just filtration in general, of the blood. Renal tissues have to cooperate with the blood vascular system. It is necessary to get fluid and solutes into tubules. This is known as passive filtration. And then its next major renal function is reabsorption or absorption and conservation. So boatloads of goodies, meaning those goodies are solutes and water into the plasma that must be recovered. Loss of set amount of these materials would be incompatible with life. So there needs to be a balance of getting goodies in and goodies out. And then next we have secretion. So aromatic rings are too big to filter through. So like just through passive filtration, that's not going to happen. It's just not. So we have to get it out somehow. So secretion is then necessary. And then secretion is one part of excretion. You don't want to get them confused because they're not the same thing. So secretion removes certain substances from non-globular capillaries. It puts it into tubules, so eventually those substances will go out into the urine. And then we have next main function is the electrolyte and water balance. So that meaning moving solutes simultaneously achieves both of these functions because the water follows the solutes. So when you're moving solutes, this is keeping water balance and electrolytes in order. And then we have excretion. This doesn't happen until the tubule fluid has left the kidney itself. It is the end of the whole process, so it's different from secretion. It is the actual removal of undesired materials from the body via urine. It deals with metabolic waste and electrolyte minerals, toxins, etc. And then we have acid-base balance. The kidney is the only organ that can get hydrogen ions out of the body in a significant amount. In renal failure, you would develop renal acidosis. This is of extreme importance. And then we have hormone production, where the kidney makes renin. It also makes various other hormones, and its renally produced hormones are actually quite diverse. And then, of course, we then have hormone regulation, which regulates the function of different hormones produced elsewhere in the body. It has vitamin D metabolism, which is an important example of hormone regulation. We also have regulation of intrarenal and systemic arterial pressure. It is important to note that both are influenced by the kidney. The kidney works to regulate its own internal blood pressure, and so you have to have blood flowing through the kidney at a constant rate. So then we got into the relevant renal anatomy. The greatest volume is the medulla. This is 2/3 of its volume. However, it doesn't mean it's any less or any more important than the cortex. So here is relevant renal anatomy. So we have the cortex here, which is the outer portion. It's about 1/3. And then, like I said, the medulla is 2/3, and it's the inner portion with 2 layers. Then we got into cortical and medullary structures and their functions. So the cortex, we're going to start with the cortex. It houses particular parts of the renal tubule and the renal vasculature. The cortical portions of the renal tubule include the glomerular capsule, the convoluted tubules, proximal and distal. And then we have the cortical vessels, which include the glomerulus and then the peritubular capillaries. The function of the cortex is filtration, very important. This never happens in the medulla because it needs the glomerular capsule in order to do this filtration. It has another function is the adjustment of tubular fluid and the role in blood pressure regulation. So the arterioles related to the glomerulus, the convoluted tubercles. So here's our picture. And the cortex is what's on top in the red box and everything it includes, like I said. So you have the glomerulus, you have the arterioles, you have the afferent arterioles and efferent, and then you have the distal convoluted tubercle, as well as the proximal convoluted tubercle, and then the glomerular capsule. Then we're going to talk about the medulla. Again, it houses particular parts of the renal tubule and the renal vasculature. The medullary tubule includes the nephric loop and the collecting ducts. The medullary vessels include the vasa recta, which surrounds the collecting duct and the nephric loop. And again, we're going to get into function. His main functions are the dilution of the tubular fluid, the establishment and maintenance of medullary vertical osmotic gradient, and the final determination of urine osmolarity, that meaning concentration, simultaneously determining the osmolarity of blood plasma. So again, the red box on the bottom is where the medulla is and what it includes. So of course we have the arcuate artery and vein. We have the ascending part, the anterior lobar artery and vein. Then we have the collecting duct and the nephric loop. So then we got into the renal tubule segments. Segments including the glomerular capsule. Then we have the proximal convoluted tubule. Then we have the nephric loop and the distal tubule, and then we have the collecting duct. And again, excretion doesn't happen until the end. So the very end right there is when excretion happens. It has to go through the glomerular capsule, through the nephron loop, back up, through the collecting duct, and then back up. So all those steps have to happen before excretion can occur. So then we got into the glomerulus, the morphology of it. It takes out solutes and fluids. The capillary tuft is between the afferent, so that means coming in, and the efferent, the exit arterioles. The capillaries are huge in numbers, huge in surface area, and very thin. And there's also very many of them. They have holes that allows things in and out. The glomerular function initiates the formation of the filtrate. So it helps sieve the blood and deliver the plasma and its filtered or stained contents to the tubule. The renal arteries are important for this section. It goes from the afferent arteriole to the glomerulus to the efferent arteriole. And then the post-efferent arteriole, its character of capillaries are following the efferent arteriole. It differs by location of associated glomerulus. There's two general groups of glomeruli. Those in the middle and upper cortex. The efferent go down into the medulla, becoming the vasa recta. Those near the corticomedullary junction, where the cortex is going to become the medulla. So the efferent arteriole of the upper and middle cortex reaches the PRCN, and then the corticomedullary junction goes into the straight arterioles. The PTCN is the paratubular capillary network. It is in the cortex, is surrounded by the proximal and distal convoluting tubercles. It gets lots of blood and is highly permeable. The straight arterioles are from the juxtamedullary glomeruli. They lie mainly in the medulla, and they're surrounded by nephric loops, and they only get a little bit of blood. So there's little blood flowing through the medulla. This is so it needs to maintain a strong osmotic gradient. Then we talked about venous drainage, except for everything has renal venous drainage except for the glomerulus and its arterioles. The venules and veins largely parallel the arterioles and arteries of the same names. The vasa recta, which is in the medulla, is a collected term for the arteriolae or venulae rectae. The nature of the vasa recta is crucial to the maintenance of vertical medullary osmotic gradient and urine dilution and concentration. And then we got into the nephron, the structural and functional unit of the kidney. One glomerulus and one renal tubule are paired together. Its renal tubule and collecting duct. The vascular and tubular components are both requisite. So what is the nephron versus the tubule? The nephron includes the vascular components, whereas the tubule is only renal. The nephron, the glomerulus delivers blood to tubule and begins filtration. The tubule completes filtration and modifies filtrate. The collecting ducts makes critical final adjustments and removes fluid from the kidney. So then we got into renal notes 2, so lecture 2 part of the overview of renal. Here we talk about the urinary renal corpuscle. It is a collected term of the glomerulus and the urinary capsule together. This is the filtration unit. So the same thing in other words. You have the urinary capsule versus the urinary corpuscle. The capsule is just the proximal most part of the renal tubule. The corpuscle means the capsule together with the glomerulus. The glomerulus, however, does not filter. It just starts filtration. It needs the urinary capsule in order to accomplish filtration. So the structure of the urinary corpuscle, it is an integral part of filtration. Like I said, you need the glomerulus, which is the capillary tuft, but you also need the urinary capsule, which is a glove that goes over the tuft. And both of these are essential, like I said, for filtration. If either is messed up, filtration is severely affected. So the proximal convoluted tubercle goes from the urinary capsule to the glomerulus to the nephric loop. And then we got into the function of the PCT, which is the proximal convoluted tubule. One being absorption, the initial mass recover of filtered goodies, like I said from before. It has prodigious reabsorption of solutes and therefore water. It has a high volume transport of a great number of substances. The volume of the glomerular filtrate is immense, constantly taking back to what you need, and what does and what you don't goes back into the tubule. So humans ourselves filter plasma volume 65 times per day. If 100 of this filtrate were voided, if we didn't have any filtration at all, the entire plasma would be lost in 30 minutes. So we would just pee ourselves and die within 30 minutes if we didn't have filtration. So the reabsorbed volume is also immense, very large. So then we got again into the more functions of the PCT. The second one being secretion. Various substances. The nephric loop is down into the medulla, like I said. Its structure contains thin filaments, which are squamous cells, few organelles not metabolically active, and then it has also thick segments, which are the thicker cells with more organelles and more mitochondria, and it is metabolically active. The thick and thin segments are variably permeable to water and solute. They are able to dilute tubular fluid and concentrate salts in the medulla, which in turn sets up the ability to excrete either concentrated or diluted urine as needed. So then we also have a distal convoluted tubule, which goes back to the cortex. Its function does more cellular work than the proximal end. It's fine-tuning part of the nephron. You can decrease or increase its function. So unlike the proximal tubercle where it has a set function and you cannot change it. It is the greater part of the distal convoluted tubule. It has fine tuning and continued dilution of tubular fluid. So then we get into the macula densa, which is part of the distal convoluted tubule. It is a greatly specialized segment. It is adjacent to the companion glomerulus, part of the JGA, and is an essential role in blood pressure regulation. So the collecting duct has its unique structure, and it has a planar principle. One type deals with sodium and potassium, whereas the other type deals with hydrogen and bicarbonate, and this dealing with the levels of pH. The collecting duct function is more than the name implies. It does conduct fluid, but it also regulates bodily potassium electrolyte balance, and it regulates bodily acid-base balance, which is the final pH of urine it's in charge of, and it responds to ADH, and it can modify tubular fluid and thereby urine to be less than, the same as, or greater than that of the plasma. The juxtaglomerular apparatus is an essential blood pressure regulatory mechanism. It affects blood pressure and flow in both the kidneys and the body as a whole. The components of the JGA, it has a tubular, which is the macula densa of the distal tubula, the arteriolar, the juxtaglomerular cells of the afferent arteriole. Like I said, juxta means next to. And then we have the extra arterial, which are the mesangial cells, and then mes meaning in the middle. So the macula densa of distal tubule is between the afferent and efferent arterioles. So I can show you that here. Sorry, Sky Buddy. The top picture there. And then the juxtaglomerular cells of the afferent arteriole. They're in purple. They're the middle one there. And then we have the mesangial cells, which are dispersed among glomerular tuft, as well as the efferent and afferent arterioles. Also in purple, but the very bottom there. So the action of the JGA, it increases blood pressure by means of hormonal and proteolytic series of changes in various substances. So then we also have the interstitium, which is a tiny bit of material that is between all of these working parts. It is negligible in substance, but huge in importance. Very little, it basically holds the kidney together. And then we got into subgross renal structure as related to the major regional functions. So first of all, we have to remember that the cortex includes the renal corpuscles, the proximal convoluted tubercle, the distal convoluted tubercle, the PTCN, and the JGA. Whereas the medulla contains the nasal loops, the collecting duct, and the vasa recta. The cortical function is to make the modify filtrate, so to filter, to add and recover substances to and from filtrate. And then the PTCN is to deliver materials to and recover materials from tubules. Also blood pressure regulation. The medullary function is the dilution of tubular fluid to concentrate medullary salts, final control over the excretion of concentrated or dilute urine, acid-base balance, and the final determination of potassium homeostasis. The kidneys make certain hormones, again in response to other hormones. Some are produced by the kidney and act there and elsewhere. Some are produced elsewhere and act upon the kidney. So the kidney itself makes its own hormones, but that affects it, but it also has hormones coming from not the kidney. So kidneys make renin, like I said, which is the blood pressure regulation. They also do vitamin D metabolism. They do erythropoietin, which is the red blood cell production, and then prostaglandins, which are locally vasoactive. And then we have the hormones produced elsewhere, like I was saying, and acting on the kidneys. Those include the antidiuretic hormone, which allows urine concentration. Then we have aldosterone, which raises systematic blood pressure. And then we have the arterial natriuretic peptide, which decreases blood pressure. And then we have the parathyroid hormone, which has to do with calcium metabolism. So that was the end of our renal lectures. I think we just have one more lecture to get through, guys. Sorry. And this was the fun one, the urogenital exam. So we're going to get into butt stuff. And reproductive stuff. So this is the first picture we got after we were doing renal stuff. Butt stuff. So here, the top circle is the anus. And then we have the perineum, which is between the anus and the vulva, which is the one here. And then we have the vulva. This is in a horse. And then we have the escutcheon, which is, so we have the vulva here, but below the vulva in bovine, we have the escutcheon. So then we got into proper vulvar conformation in a equine. So here's what it's supposed to look like. So here's the anus up here. Here's the vulva. It's supposed to be straight line looking like that. But here's an abnormal one. So the anus rectum here is more in, and there's not a straight line. It's more of a curvature shape. So what could result of this, like the poor vulvar conformation in this mare? Well, you can get pneumovagina, which is called wind sucking, which means air gets into the vagina. And then we have the pooling of urine in the vagina, fecal contamination. This would, so the pooling of urine would cause probably fecal contamination within the vagina because it would get caught here. Also, the cervix enters the vagina at a ventral position in the equine, so pooling of urine or fecal contamination could lead to the inflammation within the uterus. Also, the bovine vulva, this is where you test out its mucous membranes for color and CRT response. So I'm going to show you different vulvas here of the bovine. So here's a normal one. The one in the middle has icterus, which means yellow. If you know what jaundice is, that's basically what it is. And then the last picture here is septic. It's very red. So then we got to talk about males. We're talking about the prepuce, which is the amount of skin hanging down. It is dependent on the breed and usually larger and longer in bulls. So here, as you can see here, it's kind of small prepuce in the Hereford steers. But then we get to the bull, and it hangs down way lower, as you can see there. So how would you obtain urine in a bovine male? Well, in males, examining the prepuce is very important. Crystals can accumulate on the hairs by the prepuce, and this is indicative of urolith. But normal peeing for a bovine, they just stand there and pee. They don't even care. But if you can see, like, here are crystals on the hair of the prepuce. So obtaining urine in a bovine female, you want to get urine first on your exam. You're going to rub the escutcheon, which is the area, like I showed you, below the vulva. On midline, it is about 4 inches below the ventral tip of the vulva, up to the right under the ventral tip. You want to rub with moderate pressure, changing speed if not getting desired result. And then you continue rubbing and the cow posturing until it produces a solid stream of urine. But the non-invasive way, if you don't want to do any of that, is to put them in a clean stall. So here we got normal posture in females. for a horse and a bovine. Here's the bovine. They'll usually move their tail and then just stand and produce a huge stream of urine. Usually in equine, they would spread their legs apart and pee that way. And then we have the normal posture in males. Like I said, bovine just stand there and pee. But stallions, however, they move their feet and hunch forward because they don't want to get pee on their feet, you know? And then they pee too. So normal urine in a bovine, they usually urinate about 8 to 12 times a day. Their volumes can reach up to 16 to 50 mils per kg per day. It's usually golden in color, it's usually clear, and it has an alkaline pH. Whereas in equine, they usually urinate 3 to 6 times a day. The exception would be a mare and heat. Their volume ranges from 8 to 30 mils per kg a day. It's usually golden in color. However, their urine is usually cloudy. So mucus and calcium carbonate crystals are usually in it. And then they have an alkaline pH as well. The pH of a canine and feline urine is acidotic. So it's different from that in an equine and bovine. And why is this? It's because herbivores take in less protein. They get broken down to phosphoric and sulfuric acid and more organic bases in their diets. So a mare in heat is known as winking. So a small amount of urine, but they go multiple times a day. They pushing out of the vulva mucosa. So it's like, if you can see it there, it's like they're winking, I guess. So then we got into the basics of the urinary tract anatomy. So I'll show that to you right here. So you have the urethra right here. We have the bladder. You have the ureters heading from the bladder into the kidneys. It's really not that hard. So the kidneys in bovine are lobated. There's no renal pelvis, and there's multiple branches of ureters. So they look really cool, actually. And then we have canine kidneys, regular old kidneys. And then what is the kidney location via palpation? Well, in bovine, the left kidney, again meaning left behind, is palpable by rectal palpation. However, the right kidney is further cranial. The rumen pushes the left kidney to the right. This is why it is palpable. So if you put your arm straight in, you'll feel the back of the kidney. It is pushed to the midline by the rumen, taking up most of the left abdomen. If the rumen is very full, it can be pushed to the right of the midline. It hangs down in a fold of mesenteric fat. It is not held up tight to the dorsum, and it's between 2 and 4 lumbar vertebrae. The kidney shape in an equine, the right and left are differently shaped from each other. The right is heart-shaped, whereas the left is pyramidal. Both are flattened dorsoventrally. Each has a single renal pelvis, similar to the dog. They have mucus cells within the renal pelvis, so that's what they look like here for the equine. And then kidney location via palpation for the equine. The left kidney is palpable by rectal palpation, just like the bovine. It is dorsally against this psoas muscle, and it is between the last rib and the third lumbar transverse process. So the basics of the reproductive tract anatomy in the male. I'm going to show you just a picture here. So we need to know that they have accessory glands, which is by the prostate here. We have the vas deferens, we have the penis here, the testes, and the scrotum, and the epididymis. The semen is made in the testicles, where stored and matured in the epididymis. It's passed up the vas deferens to the urethra, where fluids from the accessory sex glands to support the sperm are deposited into the urethra for ejaculation via urethra through the penis. And then we have the external genitalia of a bull bovine. So straight up and down in a bull. They have an air conditioning system to be able to move the genitalia up and down, which cools them off. So as you can see, they're straight up and down, straight up and down. The location of the bovine testicles, they hang vertically, like I said. They're the tail of the epididymis ventral. Very pendulous compared to the equine. They are similar in sheep and goat and boar. The boar are less pendulous, more caudal and ventral. They have thicker skin compared to the equine. They have more sweat glands on the scrotum than any other area and have thermosensitive nerves. And then we are getting into the external genitalia of a stallion equine. It is tucked up within it's of thin skin. The location of them, they hang horizontally. The tail of the epididymis is dorsal caudal location. It is closer to the body and less pendulous than the bovine. Thinner skin compared to the bovine and sweat glands, but they do have sweat glands and thermosensitive nerves just like the bovine. So here's what theirs look like. But then we have a bovine penis, a bovine bull penis. They're actually very, very large. They're fibroelastic. They grow in length but not in width with erection. They have a sigmoid flexure, and they have small glands. That's what the penis is called. The penis features are similar in that of the small ruminant and boar, except at the very end, the ruminant has an extension called the urethral process. However, they all have this. It's just big in ruminants, but small in stallion and the bull. It is also a common place for stones. So here's the the urethral process, like I said, the end of it. Here's for the ram and buck. It's very long here, but stallion bull, it's very small. Again, an equine penis is also very large. I'm sure you've seen a few of those. They have a muscular cavernous penis, which grows in length and the width with erection. And they have a large glands. So equine smegma, it's actually called smegma, aka the bean, which includes skin cells and cells from the urine, etc. And then we have the base of the reproductive tract anatomy in the female, the basics. So getting into females now, we have the ovary, the uterus, the cervix, the vagina, and the vulva. The ovary is the development of the egg, the ovulation of the egg, and picked up by the infundibulum and travels through the oviduct and the uterus. The cervix is what is a barrier, maintains uterus environment, and separates from the vagina. The shape of the uterus in bovine, the uterus has a short body and 2 horns. The cervix is smooth muscle with stiff interlocking folds. And in the equine, the uterus has a large body and 2 short horns, and the cervix is smooth muscle with muscular folds. So here's the difference in what the uterus looks like and different. So here we have the cow here, we have the sow here, and the mare. But why is the sow different? Well, the sow can have multiple litters. The cow usually only carries 1 baby, but it can carry 2. But in a mare, it only carries 1 baby. So then we have the female reproductive tract in the pelvis, has suburethral diverticulum, which is slightly trickier to catheterize a female bovine, but it's still possible. The body is bigger in the equine, and the horns are bigger in the bovine. So then we have bovine reproductive tract with the pelvis. The cervix is stiff. It feels like a turkey neck, I guess. It is broad ligament longer, therefore the uterus and ovaries hang lower within the pelvis. The ovaries are often found in the lateral to the body. And then the uterine horns are longer. So I showed you the pictures. The ovaries are small, almond-shaped, and grape to walnut-sized depending upon structures and timing of their cycle. The equine reproductive tract with the pelvis, again, the surface is soft and you cannot palpate. Its broad ligament is shorter. The ovaries hang higher, more dorsal to the horns. The uterine horns are shorter and the ovaries are larger, bean shaped, and can be like plum in size to orange in size depending upon the structures and timing of the cycle. And then we got into the rectal palpation. Reasons for doing it is one, for the determination of pregnancy, reason for cow and brood mares. Also, investigating for abdominal pain like colic. This is the #1 reason for all horses to get a rectal palpation. And then breeding soundness exam for males and females. And then to examine abdominal structures, we'd use the rectal palpation to palpate the kidneys, the uterus, the gastrointestinal, like the rumen, the cecum, the colon, and lymph nodes. However, the risks are rectal tear and hemorrhage. So the precautions being we need short nails going in, no jewelry or watches, sleeves, and lots of lube. We don't push against the peristaltic waves. In bovine, you can allow them to, you can keep your hand in there and allow the wave to just pass through. Whereas horses, if you feel that wave, you must recede with the wave. The peristaltic waves, sorry, I didn't define that, are the natural muscular movement of the smooth muscle of the gastrointestinal tract, including the colon. It goes from the mouth to the anus. So then we got into vaginal palpation. Reasons for doing it is assisting in difficult parturition, investigation and treatment of retained placenta, or the evaluation of the cervix for breeding soundness exam for the mare. Its risks are the introduction of pathogens. So precautions to this, we would clean the vulva and the perineum, and sleeves and lube, often sterile and equine. So again, a pregnant cow is a normal cow. Cows have jobs that require pregnancy. Dairy must calve to begin lactation, whereas beef, calves, they become feeder steers. Heifers are the product. Pregnancy diagnoses are typically made by palpation. The gestation is 283 days, so they're pregnant for 9.5 months for bovine. There's 4 cardinal signs of pregnancy by palpation. You just have to feel one of these. So the signs being the membrane slip, the amniotic vesicle, the fetus, and the placentomes. Here's what the membrane slip is. Apparently we'll feel it tomorrow, but we're going to palpate the developing placental membranes within the uterus between our fingers. This is relatively felt in a pregnant horn at 35 days. But it can be felt in both horns in 55 days. And then we get into the amniotic vesicle. We need to know timings on these. So this can be palpated at as early as 32 to 35 days, but that's by an experienced palpator. And then by 60 to 65 days, it becomes less turgid. And then the risk of palpating amniotic vesicle would be blood supply to the vesicle on the inner curvature of the uterine horn is fragile. Rough handling may damage the blood supply and cause death to the fetus. Vesicles can be popped. Palpation of the AV between 40 to 45 days is associated with the increased risk of Escherichia coli. And the fetus can be palpated as amniotic vesicle becomes less turgid at 65 days. So at 60 days, it looks like a mouse. At 90 days, it's as big as a rat. At 120 days, it's like a small cat. At 150 days, it's like a large cat. At about 7 months, the fetus is large enough to feel again. And at 8 months, it comes back up and can feel the head, feet, usually if in position. Then we have the placentomes, which is less reliable for aging. The placentation in the bovine forms buttons, which those buttons are known as placentomes, where the material and fetal membranes join together. It can be palpated in urinary horns at day 80 to 90. Students reliably feel these at 90 days. So at 90 days, they're dime size. At 120 days, they're nickel quarter size. And 150 days, they're about $50 size. Then we got into pregnancy in the mare. Pregnancy diagnosis is typically by rectal ultrasound rather than just palpation. Pregnancy can be determined earlier in the horse compared to the bovine, with ultrasound at about 14 days. The gestation length is 335 to 360 days, so 11 to 12 months for mares. And that was it, guys. We made it. With 5 minutes to spare this time. So today was a long day. It's been a long day. It's been a long few weeks. But we're getting there. I'm quite tired. So hopefully I'll go to bed early tonight. But I hope you guys had a good day today. I miss you all back home. I really just want to come home sometimes. I'm probably sure Mom and Grandma do too. We went out to dinner tonight. I had cheese ravioli. Mom had lasagna and Grandma had spaghetti. Their meals were so big at this place. But yeah, it was really good. I got to spend time with them because I know I'm always locked in my room studying, so I don't really get to go out much. But yeah, I love you guys and thank you guys for watching.